Hi, my name is Trinity Johnson, and today I'm going to perform my medication administration check-off. Here's my ID. I'm going to scan my room for you. It's my workspace. It's in front of me. It's behind me. And to my side. Ooh. Okay, so first what I'm going to do is I'm just going to verify that I'm in a no interruption zone. I'm going to limit my conversation with colleagues. I'm not going to be checking my phone or answering any phone calls. And I'm going to make sure that the door is closed and remains closed. So what I have here is my MAR and my patient's care order form. And I'm just going to compare these using my 5 rights. So which would be patient medication, dose, route, time. So we have Jaguar Jones, morphine sulfate, 5 milligrams, IM, every 4 hours. And I'm gonna check his allergies. He's allergic to penicillin on the care order form and allergic to penicillin on the MAR. So next what I'm gonna do is I'm gonna perform hand hygiene and I'm gonna select the correct vial of medication. So here I have selected morphine sulfate and morphine sulfate on the order form, morphine sulfate on my MAR. And the expiration date is 12/20/2025. So we are good to go. Awesome. So next what I'm gonna do is I'm just gonna verify that it is the correct time. So my patient is gonna get this every 4 hours, It's been 4 hours since his last injection, so it is time to give it. So I'm gonna identify the correct route now. He's getting the IM, he's getting this intramuscularly. So to do this, we're gonna use a 3 cc syringe. I'm also gonna be using a 23 gauge needle. And I'm also gonna be using a blunt plastic cannula. All right, so next what I'm gonna do is I'm gonna calculate the correct dosage. So what I have here is morphine sulfate, 10 milligrams per milliliter. Now, Mr. Jones only needs 5 milligrams. So what I'm gonna draw up is half a milliliter of my medication from my vial. But first, I will clean the top of my vial using the alcohol pad. That's my dispose area, using circular motions. Awesome. Dispose. So I'm going to take my syringe and attach it. And I'm going to attach the blunt cannula. And we're going to draw up our medicine. We're going to only use half a milliliter. So I'm going to pull it to half a milliliter. Push the air in, pull out. Pass to what I need just to make sure I can avoid any air bubbles. No air bubbles, awesome. Scoop my cannula back on there. I'm gonna place that back. And now I'm attaching my 23 gauge needle. So I have half a milliliter. I'm sorry, there's the one right there. I've done this a few times, and that's half a milliliter I've drawn up right here. So, now that I have this, I'm gonna run back to my MAR just to make sure. Morphine sulfate, 5 milligrams, which is equal to my half a milliliter. The next what I'm gonna do is I'm just gonna go and confirm with another nurse to make sure my calculations are correct. The nurse has confirmed, so I'm gonna come back and do my 5 rights again. Got Jaguar Jones, morphine sulfate, 5 milligrams, which should be equal to my half a milliliter. IM, every 4 hours. We've done our second check, awesome. So now what I'm going to do is I'm going to prepare a label for Mr. Jones's medication. And to do that, we are going to grab some tape. And this label is going to include the drug, which is morphine sulfate. The dosage, which is 5 milligrams. And his name, Jaguar Jones. Jaguar J. Awesome. So here's my label with morphine sulfate, 5 milligrams for Mr. Jaguar Jones. So now that we have prepared our label, I can take my medication and my MAR, and I can now enter the patient's room. And as soon as I enter my patient's room, I'm going to perform hand hygiene. So next thing we're gonna do is I'm gonna find 2 identifiers, and I'm gonna use my MAR and my patient's wristband. So on my MAR here, we have Jaguar Jones, and on my patient's wristband, we see Jaguar Jones. And on my MAR, his MR number is 4176352, and also on my patient's wristband, we have that his MR number is 4176352. And we can also check that we're in the right room. Patient's wristband is room 2040, and my MAR says room 2040, so we are in the right location. Now I'm gonna check his allergies. My MAR said that he is allergic to penicillin, and his wristband also says that he is allergic to penicillin. So next what I'm gonna do is I'm going to perform any pre-administration assessment. That would mean that I would check blood pressure or pulse, and after I perform any pre-administration assessments, I'm going to do my 3rd check, and I'm gonna use my 5 rights again, which is patient medication, dose, route time. So here on my MAR, we have Jaguar Jones, wristband, Jaguar Jones, medication, morphine sulfate. I have my morphine sulfate, 5 milligrams, which is equal to my half a milliliter, my 5 milligrams. Intramuscularly, he's gonna get this in his deltoid today. Every 4 hours, it's been 4 hours, so it is time for Mr. Jones's injection. And after that, I will explain the procedure. Hey, Mr. Jones, it's been 4 hours since your last injection, so it's time for another one. I'm gonna be giving you 5 milligrams of morphine sulfate today in your deltoid, which is kind of your upper arm. Okay, Mr. Jones? Awesome. So after I've explained the procedure, I can now, I'm gonna raise the bed, and I'm gonna lower my side rails I'm gonna raise the bed to a working height, and then I'm going to lower the side rail. So after I've done that, I'm gonna perform hand hygiene, and now I can don my gloves and my goggles. So I'm gonna do that now. So I now have on my gloves and my goggles. Now what I'm going to do is I'm going to expose the injection site. And once I've exposed the injection site, I'm going to just make sure my landmarks are right. So I'm going to give this to Mr. Jones in his deltoid. So that means I'm going to go 3 fingers down from first I'm going to find the acromion process by moving his arm, and then I'll have him relax. And I'll put 3 fingers down from the acromion process, and then I'll make sure I don't go past the deltoid insertion. And under those 3 fingers, I'm going to make a V. And in between my middle and my pointing finger is where his injection is going to lie. So once I have found my landmarks, I'm going to assess his skin integrity, and I'm going to check for any bruising. There is none, so it means Mr. Jones is ready for his injection. So first what I'm going to do is I'm going to take an alcohol swab, and I'm going to clean the injection site. Dispose of that. I'm gonna make sure I start inward and work my way outward in circular motions. And we're going to dispose. So now I can remove my cap. And I'm going to spread his skin tightly. Inject. I'm going to aspirate. So I'm going to apply gentle pressure after I administer the shot and dispose of my a needle into the sharps container. Okay, so now that the injection has been given, I'm going to check for any immediate allergic reaction just to make sure Mr. Jones is fine. Once I've done that, I can reposition him comfortably, and I'm going to raise the side rails, and I'm going to lower him back down. And once I've done this, I can now remove my gloves, dispose, and now it is time for me to document the procedure on my MAR. This is the 6th right documentation, and once I've completed that, I can return back to Mr. Jones's room and reassess him for any further response to the injection. Thank you.